welcome. My name's Irene Flores, and I will be giving you a tour of the UCSF Birth Center today. I am the patient navigator for obstetric services, so I'll be assisting many of you during your experience here at UCSF. The goal of the tour is to show patients the facilities and review the process for birthing preparation, labor, and postpartum. To begin, this document contains a map to direct you to the Betty Irene Moore Women's Hospital, a handy third trimester checklist, a suggested packing list of items to bring with you, a 2-page outline of the tour, and a woman in labor sign. It is highly recommended that you call the labor and delivery unit when you think you are in labor or would like to come in and be seen. The number is 415-353-1787. By calling, you'll be directed to an advice nurse to do an over-the-phone assessment and determine if you are ready to come into the hospital or not. This helps prepare things for your arrival. In front of the main entrance of the Betty Irene Moore Women's Hospital, you will see a circled driveway, which is considered our drop-off zone. If you need to leave your car in the circled driveway, you will need to place the Woman in Labor sign on the dashboard of your car. The pass allows up to 15 minutes to check in and go upstairs to the birth center located on the 3rd floor. After 15 minutes, you must come down to move your car to full-term parking. Valet parking is available in front of the Ronconway Family Gateway Medical Building at 1825 4th Street from 8 a.m. to 3 p.m. Monday through Friday. This is the security check-in desk. We ask that all support people, friends, and family check in with security in the main lobby with a valid ID in order to be given a visitor badge, which allows you access into the birth center. On the other side of the elevators is the birth center waiting area. This is where your friends and family will wait while you are in labor. They are welcome anytime, 24 hours a day. Through the waiting area, you will find the Women's Health Resource Center Great Expectations Program, also known as the WHRC. The WHRC offers a wide variety of prenatal, postpartum classes, support groups, and items to purchase for all your nursing needs. Here you can also rent hospital-grade breast pumps. For more information, you can call 415-514-2670. If no one is sitting at the desk, you can press the intercom button located to the left side of the doors, which will alert the nurses that you are here to check in. As you check in, we will ask for 2 forms of ID, one photo ID and one with just your name on it. At this time, it is best to have your support person move your car to full-term parking. Most moms will start in triage. This is triage. Women are brought to triage for the initial assessment. The key question asked during triage is, what brings you in today? The team will evaluate you and determine if you are in fact in active labor or if you can go home. The time you spend in triage can vary and depends on how long it takes the team to determine if admission is needed and to answer your questions. After triage, you may be admitted to one of 2 rooms, depending on your condition, antepartum or labor. This is an example of one of 12 antepartum rooms. All rooms in the birth center are private with their own private restroom and come equipped with a large flat screen TV controlled by a tablet where you'll have access to educational materials, a variety of movies, and access to Wi-Fi. Each room has a couch that can be converted into a bed for your support person. UCSF will provide all linens and pillows needed for overnight. Lighting and temperature is completely under your control to make you as comfortable as possible. Now we're in labor. This is where you'll finally meet your baby. Upon admission, you'll be introduced to your care team, a primary nurse, an attending provider who can either be a certified nurse midwife or an MD, and a resident doctor. For women who are interested in medication for labor pain, your options include IV pain medication, nitrous oxide, and an epidural. After receiving an epidural, you won't be able to walk around for the rest of your labor. Our anesthesiologists meet with all patients, even if you're not interested in medication. They are available to discuss all your options and their risks and benefits. The alternative pain relief options include a squatting bar, a birth physio ball, a birth stool, a mirror, a rocking chair, and the bed itself, which can be moved in various positions. There's a mobile monitoring device if you would like to walk around while in labor. The device allows the nurses to monitor maternal fetal vitals. All 9 labor rooms have a bathtub with jacuzzi jets and colored lights. Your support person can join you in the tub to assist with massage techniques. We require that they wear a bathing suit. UCSF does not offer water births. However, you are welcome to labor in the tub. Once you are ready to give birth, you'll be moved to the bed area. Visitation while in active labor is 24 hours. There is no limit to the amount of people you can have in the room with you. However, we don't recommend more than 4. If the care team needs to limit your visitors or clear the room for safety reasons, they may do so. If there is a child under the age of 14, there must be an adult other than your support person there to care for them. In addition to your care team, there may be a nurse and a pediatric team present at the time of your delivery to assist with the baby. Once baby is born, we make every attempt to immediately place baby skin to skin with mom. It is best to have your visitors leave the room to encourage bonding. The initial assessment, wipe down, weighing, measuring, vitamin K shot, and erythromycin ointment, if desired, will take place during bonding time. Mom recovers in the labor room for about 2 to 3 hours before being moved to postpartum. This routine is adjusted if needed based on how mom and baby are doing. In the circumstance that a cesarean delivery is needed, we have 3 operating rooms. Only 1 support person is allowed to accompany mom to the OR. Once the baby is born, we still try to do skin to skin if possible with the assistance of a nurse. Once surgery is completed, mom is taken to the recovery room, located back in the triage area to recover from surgery. Support person and baby will be able to meet mom in the recovery room. This is an example of a postpartum room. This is where you go after you give birth. After a vaginal delivery, you will stay in postpartum unit for 1 to 2 days. After a cesarean delivery, you'll stay in postpartum unit for 3 to 4 days. You will find that all rooms have a baby bassinet to provide rooming in as part of our family-centered care. This will help you learn how to rest and care for your newborn. While you are recovering, you can expect visits from the OB team who cares for you and the pediatrician team who cares for baby. You can also expect visits from the birth certificate staff to help complete your birth certificate. Bella Baby, a professional photography service that is available to take photos of your new family. Postpartum nurses who are trained to help you with all your breastfeeding needs. If additional assistance is needed, our lactation consultants are available 7 days a week, as well as a hearing technician who will visit you while the baby is asleep to do a hearing exam. There are 2 important requirements for discharge. We need to see the infant's car seat and schedule the first appointment with the pediatrician. If you do not have a pediatrician in mind, we can make an appointment with one of our UCSF physicians and you can switch providers afterwards if desired. In regards to food, in-room service is available from 7 a.m. to 8 p.m. and you can have up to 3 meal trays a day. There is a wide variety of options to choose from and our food service caters to all diets. Your support person can purchase an additional meal tray if needed. Outside food and snacks are more than welcome. We hope you found this tour helpful. Feel free to contact me should you have any additional questions. Congratulations, and we look forward to seeing you soon.